moved by the member for Vaucluse be agreed to. I call the member for Coogee.
Thank you. Mr. Speaker. Well, I rise today to speak in support of the motion put by the member for Vaucluse. I'm sorry. I think, one of the most encouraging things of all that we can observe in the area of mental health is the fact that we, as parliamentarians, are talking about it right here in this place, in this House. We've come so far over the last few years in recognising this debilitating condition that ruins lives, it ruins families, it affects our communities and it affects our economy. Our recognition of this issue may be late in coming in this place, but it is vital if we are to be seen as leaders in our community, leaders in our own communities, leaders in destigmatising mental health, ensuring that those that do need treatment seek it. Thus, I'd like to congratulate the new government on its strong commitment to improving the lives of those who suffer with mental illness. This government has wasted no time in delivering on its election promise to change the way in which we diagnose, treat, cure and hopefully prevent mental illness. The most significant accomplishment of this government is the establishment of a Ministry for Mental Health. Last month we established Mental Health Month to recognise all those that contribute to this important field. A mental health task force has been established, and by July 2012 New South Wales will have a mental health commission to ensure the future funding of mental health. Last week both the Minister for Mental Health and the Minister for Health were at the Prince of Wales Hospital to witness the commencement of this government's $15.4 million investment for a mental health intensive care unit at the Prince of Wales Hospital. Now, I noticed that the member for Lake Macquarie made some assertions about the inaccuracies of the budget. Now, it's probably because they haven't correctly read the budget papers. I, for sure, as the member for Coogee, welcome the addition of this extra funding, this $15.4 million at the unit at the Prince of Wales Hospital, as it's going to be an important facility to complement the existing inpatient facilities for mental health at the hospital. The hospital has a long history of treating mental health patients dating back to World War I. Today the hospital is home to the Black Dog Institute, which recently celebrated its 10th anniversary. It was founded by Professor Gordon Parker, who's about to retire, as mentioned by the member for Vaucluse. The Black Dog Institute has pioneered the alternative methods of diagnosis and treatment in mental disorders and has become a centre of excellence in the treatment of the bipolar disorder. And this is
Order. I'll remind the Leader of the Opposition that he's already on 3 calls. No, you're on 3, and I'm sure you'd like to stay in the House for the rest of the afternoon.
That'd be a shame.
So, Mr. Speaker, I want to take the opportunity to remind the House of the major commitments made by this government to my electorate of Coogee for the Prince of Wales Hospital since coming to office. In the September budget, this government committed over $50 million for projects into this hospital, including funding for this important facility. $6 million in funding was also announced for the neuroscience research facility and $1.2 million for an extra 5 doctors at the emergency department of the Prince of Wales Hospital, which is critical to the quick triaging of admissions. The Eastern Suburbs Medical Health Service is responsible for the provision of public mental health services to residents within my electorate of Coogee and the electorates of Vaucluse, covering the 4 local government areas. But over the last few years, mental health services at the Prince of Wales Hospital have been stretched to the limit. To give you some idea, between July 2010 and June 2011, 1,229 patients were treated as mental health patients at the Prince of Wales Hospital. There were 1,197 overnight episodes of care. And the average age, which is really disturbing, of the health clients was 42, with 75% of them aged between 16 and 50-year-old age group. So, as you can see, there's a huge need, and this government is meeting the task and stepping up to provide the long-needed overdue services that are
Order.
required.
The member's time has expired.